Hello, classes. I'm going to go over the muscles of the arm. The muscles of the arm that will be covered in this video include the deltoid, biceps brachii, brachialis, and triceps brachii. Though, for the purpose of this demonstration, other muscles of the forearm, like this one, the brachioradialis, may be included. The reason why it's going to be included is to be used as a landmark. So let's start with that. Highlighted here in yellow is the brachioradialis. It is named for its origin and insertion. As always, the origin is listed first in the name, and then the insertion is last. So right away, its name takes away some memorization. You don't have to memorize that its origin is coming off the humerus. That's where your brachium is. That's your arm. And it inserts on the radius. Now, the reason why I'm including this muscle in our discussion of the arm, the upper member, the more proximal region of the upper member, is because you can see where it comes off of the humerus here. You can actually see a line of white connective tissue. And I like to use the brachioradialis as a landmark because where it comes off of the humerus separates the anterior compartment from the posterior compartment. So shown here on the posterior side, we can see the triceps. The triceps have three origins. And according to your hit list, we want you to know that the origins are the posterior humerus and also the infraglenoid tubercle. The infraglenoid tubercle is found within the glenoid cavity, or is part of the glenoid cavity of the scapula. Your teacher may want you to know the long head, the medial head, and basically all heads of the triceps brachii. For my class, I don't care if you know the long head of the triceps brachii, which is shown here with its origin from that infraglenoid tubercle that I mentioned, or the lateral head, and then deep to these two would be the short head. I just want you to know that the triceps brachii is named that because it has three origins. Its insertion will be the olecranon process of the ulna, and its action is to extend the forearm. Moving back, another muscle of the arm that we want you to know is the deltoid. And again, your teacher might want you to know the various parts of the deltoid muscle. There are different parts. There's an acromion part, there's a scapular part. For my class, I just want you to know that all of this, shaped like a triangle, is the deltoid. In fact, that's where it gets its name because of its shape. Its origin is the clavicle, the acromion, and the scapular spine. Its insertion is the deltoid tuberosity of the humerus. And it does have a few actions, but its primary action is to abduct. That means move your arm away from the midline of your body. Abduct, to take away. Abducts the arm. Very useful when you're doing jumping jacks, for example. Now, the next muscle I want to highlight is the biceps brachii. And again, biceps tells us it's named for the number of origins it has. It has two heads, two origins. One of its origin is the supraglenoid tubercle, found within the glenoid cavity of the scapula, and the coracoid process of the scapula. The biceps brachii inserts on the radial tuberosity, and this means its action is flexing the forearm, but also supinating the forearm. Remember, the forearm has special actions where you can rotate the radius around the ulna. You can pronate and supinate your forearm. The biceps brachii not only flexes the forearm, but is also capable of supinating the forearm. I'm going to rotate and come back to our landmark, the brachioradialis, which separates the posterior compartment from muscles of the anterior compartment. I just covered the biceps brachii. Let's now cover this muscle that is deep to the biceps brachii. But from a lateral perspective, you can actually see portions of this muscle, portions of its belly sticking out laterally. And this is the brachialis. It has its origin on the anterior side of the humerus, distal side of the humerus, not proximal. Remember, proximal refers to the point of attachment near the scapula. That's not where we are. It is distal anterior portion of the humerus, and its insertion is the coronoid process of the ulna. And this allows the action of flexing, the forearm. Moving on to our PowerPoint demonstration for the muscles of the arm. Here we see the deltoid. This is a side picture of the deltoid. We could see part of its triangular shape here. Here are two other perspectives of the deltoid. This one from a human cadaver, and I'm outlining the deltoid here. Here is another perspective of the deltoid on a shoulder model. And again, the deltoid has its origin on the clavicle, the acromion of the scapula, and the scapular spine. I'm trying to move my picture here. Its insertion is the deltoid tuberosity of the humerus, and its action, as I said before, is it abducts the muscle. The biceps brachii can be seen here. Remember, it has two origins. The biceps brachii has one origin on the coracoid process and the other one on the supraglenoid tubercle of the scapula. Its insertion is the radial tuberosity, and it flexes the forearm and supinates the forearm. Here is a picture from a cadaver, and we can kind of see the two bellies originating there, and I'm highlighting again the biceps brachii. Our next muscle is the brachialis. And I'll remind you from my earlier segment just now that a muscle from the forearm called the brachioradialis can be a useful landmark. I'm highlighting the brachioradialis here in purple. It separates the anterior compartment of the arm from the posterior. So in blue, I am now highlighting the brachialis. It is deep to the biceps brachii, but from a lateral perspective, like what we're seeing here, we can see a portion of it sticking out from the lateral view. On this other model, we can see the brachialis right here. I'm highlighting it again in blue. Our brachioradialis, our landmark muscle, if you will, helps separate the posterior compartment from the anterior compartment. The brachialis has its origin on the anterior distal side of the humerus. It inserts on the coronoid process of the ulna, and its action is to flex the forearm. So here again is another view of the arm model. We are seeing mostly a posterior view, and we can see a portion of the brachialis sticking out on the anterior side of the humerus. Our last muscle of the arm is the triceps brachii, which is found on the posterior side of the humerus. It has three origins, therefore three main bellies. Has a long head, a lateral head, and a short head. Most professors will not ask you to identify them individually, but you should always check with your professor. The origins we want you to know are the posterior humerus and the infraglenoid tubercle of the scapula. Its insertion is the olecranon process of the ulna. And I am highlighting in purple the triceps brachii, and we can see its lateral head and long head here. And the action of the triceps brachii is to extend the forearm. Here is a cadaver view of the triceps brachii, and again we can see two of those heads here. That is the triceps brachii. Thank you for listening.